Amidst the global COVID-19 pandemic, South Korea's successful story of infection control is at the center of global attention. This is because of South Korea's highly organized infection control system, which has outlined a meticulous set of standards. We've recently developed the guidelines for preventing cross-infections of respiratory infectious diseases. Cross-infections occur through person-to-person interactions, involving hospital staff, patients, guests and visitors or mediums, such as medical devices or supplies. These guidelines deal with three key areas: the operation of wards, dedicated to patients with respiratory infectious diseases, transportation of confirmed cases, and the roles of healthcare teams in wards, dedicated to respiratory infections, and methods of cleaning, disinfection, and waste management. First, we'll look into the guidelines for the operation of wards arranged exclusively for patients with respiratory infectious diseases. A ward dedicated to respiratory infectious diseases refers to a unit that is established in order to prevent the infection of other patients and healthcare workers in the process of treating respiratory infectious disease patients, and further to suppress the transmission of causative pathogens in the local community. In order to prevent the circulation of air from isolation rooms occupied by confirmed cases to other areas within a hospital, the dedicated ward must consist of single-occupancy negative pressure rooms, in principle. They can also be assigned regular single-occupancy rooms installed with equipment that supplies outside air quickly while preventing the room's air from spreading into the hospital. The second part of the guidelines handles the basic rules for transporting confirmed cases and roles undertaken by the dedicated healthcare team. Next, let's look into the basic rules we need to observe when transporting confirmed cases. When transporting a confirmed case of a respiratory infectious disease, the transportation team consists of a minimum number of personnel, including a driver, health service worker, and healthcare worker. Only the transportation team and patient then board an ambulance with no other persons allowed, and advance notice is provided to the receiving healthcare facility so that proper preparations are taken prior to patient arrival. While transporting a patient, any contact personnel must wear personal protective equipment, such as an N95 mask, disposable long-sleeved plastic gown, disposable gloves, protective goggles, and surgical hat. The patient must also wear a mask during transportation to minimize exposure through the respiratory system or physical contact. Each patient transportation team consists of 2 persons and is responsible for taking over a patient from emergency medical services personnel. The support department is responsible for the designation and management of hospital access and restricted areas. For more details, please refer to the table outlining the roles of the dedicated patient transportation team. When patients are admitted to the dedicated ward, the dedicated healthcare team performs 3 major duties: patient care, infection control, and administrative support. For more details, please refer to the table outlining the roles of the dedicated healthcare team. Any hospital staff who comes in contact with patients in a dedicated ward must wear PPE. In principle, patients, guardians, or visitors are prohibited from entering a dedicated ward. However, in unavoidable circumstances, Only family members can visit a healthcare facility after they are tested for respiratory infectious diseases. Visitors to a dedicated ward are required to record their time of entry and exit, name, etc., and receive education on infection, control, and prevention. The last part of the guidelines specifies methods for cleaning, disinfection, and waste disposal in healthcare facilities. You must only use disinfectants that are approved by health authorities. Such disinfectants include sodium hypochlorite and alcohol for contaminated surfaces, which are generally used in healthcare facilities and proven to work against viruses. You must manage open disinfectants to prevent contamination, and when reusing a container, it must be disinfected or sterilized after cleaning. Trained dedicated personnel are assigned to perform cleaning and disinfection. When cleaning a facility, it is recommended to wear PPE and then use a mop soaked in cleaning solution or disinfectant solution instead of a broom or vacuum cleaner in order to prevent the spraying of pathogens into the air. You must disinfect a room occupied by a respiratory infectious disease patient on a daily basis and after patient discharge. For areas and medical equipment used by a confirmed patient, make sure not to expose them to other people. Clean and disinfect surfaces, and leave windows open for ventilation before, during, and after cleaning and disinfecting. After the completion of cleaning and disinfection tasks, you must remove all PPE and discard them in the designated medical waste container. And perform hand hygiene using an alcohol-based hand sanitizer or water and soap. If the staff who performed cleaning and disinfection subsequently develops a fever or respiratory symptoms within 14 days after disinfection, health authorities must be notified with immediate effect. All types of medical waste generated from a ward dedicated to respiratory infectious diseases constitute waste that can cause harm to people. Separately dispose such waste, and within 7 days after waste generation, entrust the waste disposal task to a licensed waste management service provider for waste collection, transportation, and incineration. Waste collectors can wear the same PPE as healthcare workers. The safe disposal of isolation medical waste is carried out in 3 stages: generation and storage, collection and transportation, and incineration treatment. Waste collectors can wear the same PPE as healthcare workers. In principle, isolation medical waste is transported and incinerated on the same day. But in the case of a facility located in an island area, waste can be stored separately in consideration of the local characteristics, and then needs to be transported and processed promptly within 2 days. As it is often said, the best defense is prevention. Therefore, it is necessary to carefully read and understand the guidelines for preventing cross-infections of respiratory infectious diseases.